My name is Peter, and welcome GFR Spotlight. I'm here with the great Dr. Robin West. In this interview, will I manage to not only talk about just Alex Smith and focus on her life? Will I manage to not only just say, what's it like to be a woman in a male-dominated field? Will I manage to not completely fanboy over this amazing woman's life? We'll have to see next on GFR Spotlight. Welcome back to GFR Spotlight. I am here today with the amazing Dr. Robin West, and for this interview, we're going to be talking about a lot of different things in her life and how Dr. West balances all the different challenges she has in her life, and hopefully you guys will be able to pick up a tip or two about how you can apply what she does in her life for you. So, with that, Dr. Robin West. I have to say, your name is actually fun to say. It has a nice, good flow to it.
It's like Batman and Robin, right?
Oh! So if Adam West and Robin got married,
there we go.
We got Dr. Robin West. So why don't you start off telling everybody, who are you?
I'm an orthopedic surgeon, a mother, wife, sister, friend, so I'm a lot of things. But I do sports medicine, so I'm orthopedic surgeon in training, and then I did a sports medicine fellowship, which means that I did an extra year after my residency training in orthopedic surgery to specialize in sports medicine.
Because I listened to one of the things you said in the past was how swimming played a big part of your life. If I remember, there was something that happened with your high school swimming championship or something. Would you like to tell us a little bit about that?
Yeah, so I grew up playing sports. I was very active. My mom, I was raised by a single mom, so she worked all the time. She couldn't drive me to and from practices, so I was kind of on my own, always trying to find things to do but staying active. When I went to high school, I decided to try out for the high school swim team, and I grew up in Southern California in Santa Monica, where everyone on the high school team had been swimming since like age 3.
Yeah,
right?
yeah.
And they'd been competing at high levels. So here I am going to try out for the swim team. And at first, I didn't really think much about it. I'm like, yeah, I'm a good swimmer. I'll just try out. And then I realized, like, oh my gosh, the competition's crazy. Like, these people have been swimming the whole time.
Yes.
And so I was really scared. And my mom said, just go try it. Like, why not try it? Just go do it. And if you don't get on, you don't get on. It's not a big deal. But to me at that age, coming into 10th grade, it was high school, thinking, how the heck am I gonna, this is like really scary. But anyway, I competed that whole summer and really worked up to it, and then tried out for the team and made the team, and I wound up winning MVP that year.
Oh.
And I realized, okay, if you set your mind to something and you work hard for it, it's a possibility, right? So at that point, I realized you can step outside of your comfort zone and try something.
I heard in high school that in their swimming championship, you swam against a very famous swimmer. Can you tell us what that was like?
I did. So in my senior year in high school, I had made the swim team, and I wound up, I was a fast sprinter. I was a 50 meter sprinter.
Yeah.
And so I was the anchor of the relay. And so my relay made it to the CIF, which is the Southern State Finals. And so we go to the state finals. Actually, we're in the semifinals at this point. And Janet Evans, who is she's the most gold winning medalist of any Olympic swimmer, so she was the anchor on the relay next to me. So unfortunately, her team was a little faster. We came in second to her, but it was awesome to swim right next to her and to stand beside her, as we dove off the blocks. But
and I mean, to actually get to compete against the best, it definitely elevates your game.
It does, yeah. It's exciting.
So you are in college, and then you get mononucleosis, and you find out you can't swim the whole season. And I know after that, that's how you started to get into the field of orthopedics. But the question I want to ask you, because you were, 18, 19 at that time? That's a very mature decision. So what do you think characteristic-wise, how'd you come to that decision?
Yeah, it was tough. When I got mono, I wasn't allowed to swim because your spleen gets enlarged. And so if your spleen gets enlarged and you get kicked or something, or when you're diving, you can rupture your spleen, right? So the team physician said you can't swim. And so at that point, it had, like you said, really devoted a lot of time to it and energy. And I like being busy, as you'll find out. I like to have a lot of things on my plate and managing things. So I was like, I'm just going to be in school. Let me think about other things I like to do. I knew I loved to be around sports, athletes, and I liked medicine at that point. So I kind of put it all together, and I talked to the head athletic trainer and said, can I come work in the training room? And they had this program that you could become a student athletic trainer.
Oh, okay.
And so I got to work with the football team that year, and that was my first experience with football. And so that's kind of where it all started.
Remember reading up that's like something you decided with medicine when you were 5 years old, I believe. So how at 5 years old or did you come to decide medicine? I'm a doctor now and I'm still struggling deciding with medicine. How'd you come up with that at age 5?
Yeah, it's funny, I think my pediatrician played a big role. My pediatrician, I remember, was this really gregarious guy, and he'd smoke a cigarette. And he talked to me, come to the office.
That must have been a long time ago. Smoking a cigarette in the office.
It was a long time ago.
Well, I'm sorry about that lung cancer.
So it was funny, but you know what? He was so personable, and I really liked the way he treated me, and he really cared about everything about me. He'd ask me about my parents were separated, and kind of asked me about my life and about my whole being, right? Not just was I healthy or not healthy. And so I liked that aspect of it, and I thought, I'm going to do that. I want to take care of people from all ages, and I want to be able to be part of their life. And then at age 5, I was at my uncle's house.
Yeah.
My parents were engineers, but I went to my uncle's house, and he's an anesthesiologist.
Yeah.
And I remember I was sitting at his desk. He lives in Seattle, and I was scrounging around his desk and looking at all this stuff, and I found a Grey's Anatomy book.
Oh.
And I started looking through it, and I remember this so vividly, and I saw a picture like a human knee, and I was looking at it, and so I remember I brought the book to my mom, and I said, I want this book for Christmas. So at age 5, I have a Grey's Anatomy book.
I feel like when you open that Grey's Anatomy book, it was like the lights from heaven lit down. There were doves flying everywhere.
Right.
Wow.
I mean, it's funny because that's orthopedic surgery, right? But at that time, I didn't really know what it meant. I just knew it was anatomy.
Let's jump now back to college. So how did you make the final decision to do orthopedics?
Orthopedics came about. I was in the athletic training room. I got to see, again, the athletes, and I got to work with orthopedic surgeons in there, and I got to observe some of the surgeries. So I think I always liked it kind of through high school, just seeing injuries and having injuries and dealing with that. In the back of my mind, I thought that might be a profession I like. And then once I went into the athletic training room, I realized this is what I really like. I love taking an athlete, from an injury, take them through that recovery period and then back on the field, and kind of having that whole process.
So with that, the process. So you finish college and you decide to go to medical school. What was your experience like in medical school, and why were you able to succeed? What did you have to do day to day in medical school?
I went to Johns Hopkins undergrad, and it's a very competitive undergrad. And then also I was working 20 hours a week in the training room. So I was busy. And so I came to medical school, and all of a sudden I just had that to do. I had nothing else to do. I wasn't working outside of it. I was just focusing on school. I'd already done so much science. Undergrad, I was a biology major. So it's sort of, I had already done a lot of the work. So I didn't fight. I loved it. I loved what I was doing. So that makes it easy, right? If you love what you do, it makes it a lot easier.
After medical school, where did you go after that, after medical school?
Yeah, so after medical school, I did my orthopedic surgery residency training. My daughter always asked me, she's like, how much school did you do? So, after college, right, you do 4 years of college and you do 4 years of medical school, as you know, and then I did 5 years of residency, so to train to be an orthopedic surgeon. I did that at George Washington University, and then I went on to the University of Pittsburgh for my sports medicine fellowship. And so at the University of Pittsburgh, at that point, I'm looking for a job and trying to figure out where I'm going. And I love the DC area, and I was thinking about coming back here. And had a few offers I was looking at. But Dr. Fu, the chairman of the University of Pittsburgh, asked me to stay on there and to be an assistant professor there, as well as help take care of the teams. And so I accepted that offer, and things kind of grew from there. And so I also accepted the offer to help Dr. Jim Bradley, who's the head team physician for the Pittsburgh Steelers. So I took on this role. Again, I was starting my practice. I was excited to just take care of just anyone, like patients, and do surgery. And then when I got these offers to take care of the University of Pittsburgh, Carnegie Mellon University, and the Pittsburgh Steelers, I would talk to my husband, like, should I do it? Or what should I do? It's a lot of work. And he's like, this is an opportunity. I mean, this doesn't always come, right?
Yes.
It's like things come at a crossroads. I always tell people it's a crossroads of hard work and sort of an opportunity. Because people always say to me, oh, you're so lucky that you are part of this. You're so lucky, right? You hear that a lot.
Yes.
There is some luck involved. And I always tell people, but you don't get there by just being lazy.
It's a leap of faith. A lot of things you have to
Yeah,
do.
right. It's this kind of combination. You got to work hard, and then something comes up, and you got to take that chance.
So actually, so let's dive into that. So like your experience. So what was your time like working with the Steelers?
Yeah, so it was great. I mean, I had had a college football experience.
Hmm.
Obviously, it was at Johns Hopkins, which is a Division III
Yes.
college, but I had had the experience working with athletes and had been an athlete myself. So coming into that was a great experience. Dr. Bradley was a great role model, and
Hmm.
it was really, I'm a big believer in collaborative teamwork and working together.
Yeah.
And so that's what I really learned. I took that from the training room at Hopkins, and then when I went on to the University of Pittsburgh for my fellowship, you realize that there's a lot of integral parts to it. You've got your athletic trainers and your strength and conditioning coaches and your physical therapists, and everyone's got a little role. And a lot of physicians come in and say, "Well, I'm the head team doctor, I'm this," and you're like, "I'm the important one," but actually, like, I'm the most minute portion of it, right?
Yes.
I mean, I'm there for somebody gets injured and to maybe help guide some recovery or rehab, but everyone plays a big role, and the athlete's at the center of it.
All right, so that one I actually want to dive into that taking care of the athlete because the medical ethics of it, the complications. So the question I want to ask is, how do you balance that? Because what your time at the Steelers and Redskins, the Dr. Hippocratic Oath, do no harm, and yet you're making decisions where literally millions of dollars are at stake. So professional wise, how did you balance that ethic wise throughout athletic career?
Yeah, I think you always put that patient first, right? That's the
Hmm.
number one goal. And it is interesting because we are consultants for the team. So
Yeah.
so we're hired by the team. We don't work full time for
Yeah.
them. We have our own practice, but I always put that patient first. And
Hmm.
and so when you look at them and you look at their career, it's certainly a fine balance, right? If
Yeah.
you're taking care of my daughter plays
Yeah.
soccer or lacrosse, and if she gets injured, it's going to be different because she can have some time to recover.
Exactly.
These athletes, this is their livelihood.
Exactly.
And so how do I help them make the right decision for their career? Do they need surgery? Do they need
Mm.
rest? Do they miss time? And obviously politics come into it because you've got contracts, you've got agents, you've got all these things. But my goal is always to educate the player and to say, hey, listen, this is what you have, and these are your risks if you wait to do whatever, or if you postpone something or play with this injury.
Mhm.
And so we make sure that communication's key.
The Washington football team, there you were a big part of helping to treat Alex Smith. I even saw a photo, there's photos of you even when he was down, like you were on a golf cart and all that. So, in terms of ethics, you had then at that time a lot of Monday morning quarterbacks and WebMD doctors for over a year and a half, probably second guessing you and questioning you. So, like during that time, like how did you balance everything ethic wise and doctor wise dealing with that case?
That was probably the biggest case where we had that, because it was such an
Hmm.
extended period of time where he's
Hmm.
making this long recovery from a horrible injury, and no one really knows what's happening behind the
Exactly.
scenes, right? You see an injury on the field,
Yeah.
and all you know is that. And then you start hearing, oh, he has an infection, he has this.
Mhm.
And so, oh, yeah, what are the doctors doing? And
Yeah.
they're doing a horrible job, but no one knows. So
Exactly.
you're in this little bubble. And, I got very close to Alex and his family, obviously. And the number one priority was always Alex
Of course.
and no one else. And so we have to make sure that he's taken care of. And so we keep it in our bubble. And the hard part with that was it was such a complex and hard case
Hmm.
that it was a microcosm of the physicians too.
Yes.
I couldn't even talk about it with my colleagues or couldn't talk about it because we have HIPAA, and
Exactly.
obviously, and sometimes we can talk about things with our colleagues because we can run a case by it. I can run a case by
Exactly.
it. It's an anonymous case, and we can talk
Exactly.
about it. I can say, hey, I have a hard case.
Yes.
I got this case, and we can talk that way. But with this, I couldn't do that.
Yeah, because you couldn't be like, oh yeah, I have a patient with a spiral fracture, spiral compound fracture.
Right.
They're like, Alex Smith.
Yeah, so it's like, and then patients are asking you, and then you hear on the news,
Yeah.
and so. But you know what? It was that whole thing of just putting this comprehensive care together, and so luckily I have some incredible colleagues, and
Mhm.
the trauma surgeons and the plastic surgeon. We work together, and our infectious disease, docs.
Mhm.
We all get together, and we're part of the team, and so together we fought through it and tried to provide them the best care possible. And luckily, I have a friend, Johnny Owens. He's a physical therapist at
Mhm.
Center for the Intrepid. And so early on in Alex's injury, I asked Alex and his wife, I said, would you mind if I reach out to him?
Yeah.
Because he potentially can help you one way or another. Because the Center for the Intrepid, he's rehabbing
Yeah.
injured warriors, right? People who've had injuries like Alex, where they've had complex injuries, and they're either having amputation or they're having a limb salvage, they're going to save the leg. So when I called Johnny, again, the first 2 weeks into Alex's injury, I said, Johnny, I'm going to need you one way or another. I'm going to need you because we're either going to save Alex's leg or we're going to have to amputate his leg. And I'm going to need you to help me on all the aspects of recovery, nutrition, the whole fortitude, the whole mental aspect. It's a huge aspect. So he's like, whenever you're ready, we can bring him out to Center for the Intrepid and we can work with you. And so I think by getting the knowledge and working with people, making that big collaborative experience, that's what, helped us, right? It helped everyone get through it.
Okay, so back on the Washington football team. You are in Dallas against the Cowboys. The world doesn't stop. You still have to continue on as the team doctor the following week. You're in Dallas. You're doing the game, and then you get a phone call about the complications of Alex's injury. What was that like, and what was your thinking process at that time?
Yeah, it was tough because injuries happened on Sunday, and then the game was on Thursday against Dallas.
Oh, wow.
On Thanksgiving.
Yes,
so we had this short period of time. So we operated Sunday night, late into the night. And then I'd see him Monday and Tuesday. And Tuesday, when I see him, he wants to go home.
Yeah.
And I convinced him to just stay one more day.
Yeah.
Because this is a big injury. Let's keep an eye on you.
Yeah.
And that night he spikes a fever. So now we're coming into Wednesday morning.
What was the fever up to, like 104, 105?
No, not that high. It was kind of that 101.5.
Oh, okay.
101.5.
Yeah, okay.
Where you start to say, that's a little abnormal because fevers aren't common after a surgery,
Exactly.
and after an injury. But we start to say, once it goes over 101.5, then we start to do this whole process. We take blood cultures, urine cultures to make sure there is an infection.
Okay.
So at that point, then the blood cultures come back positive. So they come back positive when I'm on the flight to Dallas. This is now Wednesday afternoon. I'm flying to Dallas for our game Thursday. And I get a call, the blood cultures are positive. Still, we don't know what the source is. That means that he's got an infection. But do we know where it's from? Is it from his Foley catheter?
Yeah.
Is it from the wound? I mean, there's still things that could be from.
Yeah, you still had a lot of differentials left to do.
Yeah, lung issues. So still things. And the ID specialist said, let's look at the wound and everything. So my trauma surgeon partners looked at the wound and said, everything looks okay. Let's just keep an eye on it. And then under 12 hours later, the cultures are coming back. More and more cultures are coming back. We took a bunch. And then the wound is starting to go downhill. It looks bad at that point. So my partner calls me. This is now Thursday morning as we're heading to the game. I'm about to leave to the game. Yeah. And he calls me and says, we have to go to the operating room. I think the source is there. And so then at that point, I flew back home and we did surgery. And then from that point on, we operated every single day for, I think, eight days straight.
And then, so what was so when you get that phone call that you got to head back to DC, what was running through your mind at that time?
That I'm lucky to have some great partners. I mean, I have, obviously I'm very worried about Alex, and I have, you've said I'm trying to balance a lot of things. I'm trying to go on with my normal job. I've got great partners who are at the game with me, so they can cover that game. Yeah. I can leave. I have to go and take care of this. This is more important at this point in time. So, again, I'm lucky because you can't do it alone. You've got to have great people on both sides, and I did. And so having someone to help cover the game with Dallas, and then also coming to the surgery and knowing that my trauma partners are there.
I remember earlier in the interview, you even said that even in your time with the Washington football team, you still had patients in an office and all that. Because I think the average person always just thinks, oh, team doctor, you just live at the facility all year round. You cater hand and foot. That's all you do. So I know you just recently finished there, but I would like if you can elaborate, what was it like day-to-day management, balancing the job with the football team, the Nationals, and still seeing patients at Inova? What does it take to balance all those different roles?
Yeah, it's a combination of having great partners at every place that I'm working. I saw 40 patients yesterday in the office, and I booked 10 surgeries yesterday, and I have 10 cases this week, and so I'm trying to do that as well. I'm also the president of the musculoskeletal service line, which means I oversee all orthopedics and all PM&R, all physical therapy across our whole system.
Yes.
So it's 500, 600 people.
Really? Wow.
In our section. So So it's a lot trying to, again, balance everything, but having great team members around and great colleagues to help. I'm a big believer in that because you can never do it alone.
Yeah.
And so that's how we make it all work. Having great people on the clinical side to help getting these patients scheduled to see me, get surgery done. Again, I like to be busy, so sometimes I feel a little overwhelmed, but again, it's all about, a team and being part of a team.